Yeah, thank you, Samantha. I'm a neuroradiologist. I have been involved in the stroke program since its inception. Stroke program was brought to this hospital by my colleague and partner, Dr. Dave Turetsky. And the stroke went from a devastating diagnosis to almost a curable event now. We spent a lot of time talking about how to recognize the early symptoms of a stroke, how time is the most important thing when you're having a stroke. And if you think you're having a stroke, the best thing to do is call 911 immediately and let them evaluate you, because all the time that's wasted by worrying about whether you're having a stroke or not can be very important in what we can do for you. As this process has matured, I think we've done 130, 140 strokes year to date. That's an unbelievable number. And so when you look, one of the most important things we're discovering now is Advance Directive. Strokes occur in all age groups, but they're most prevalent in our senior population, which is now me. It's very important that when you have a stroke, that you come to the right place, number one. Number two, that we know what medications you're on. And number three, what time did the symptoms start? And the last part of this is whether you have, they always ask you whether you have an advance directive or a living will. Now, as you can see, that is a document that is for those who follow after. It's very important for the patient, but it's much more important for the family and caregivers of the patient, so we know what your wishes are, and it makes your wishes known to us if you become unable to speak for yourself. This is most important in trying to plan your care. We do everything possible to have you recover from a stroke, but sometimes that's not possible. The Advance Directive I call a living will. What it is, it gives us some guidance in how you want to be treated, how aggressively we want to treat you in the event that you have a catastrophic illness. And think of it again as a living will. It's information that you pass on to us while you're able to do that. And it's done in a written form that's notarized or signed by a witness for you. So that's an excellent question, Samantha. In the state of Florida has always been very progressive. We have both federal laws and we have state laws that give you the absolute right to make many of the healthcare decisions in advance. And so that we know what your wishes are, we can honor them in the event you can express them yourself. And if you just Google a living will or a power of healthcare, a power of attorney or healthcare surrogate, you'll see probably 25 different avenues for you to obtain a living will. And those living wills have what we call advance directives. They have a healthcare power of attorney, as somebody who can speak for you when you can't. They have your living will, what your wishes are. They have healthcare instructions. How far do you want to go in trying to save your life? Do you want to be intubated on a ventilator for the rest of your life if you cannot become available for such? There's also a donor registry if you want to be an organ donor for such, that's included in this packet. Exactly. Using the FSU medical students, one of our medical students here in Florida State University had a personal family experience with her grandmother who didn't have advance directives, and she understood after the process was over exactly how important that was. And I got to give her all the credit in the world because she took it upon herself to get us meaning the physicians in the emergency room, physicians in the hospitals, and the first responders involved in the process to put together what we call a living will or advance directives package. And she had the brilliant idea of putting this in a plastic bag in your refrigerator. In other words, you fill out the forms in this plastic bag and you put them in the refrigerator. And then we taught the first responders to look in the refrigerator for that packet because we know everybody has a refrigerator in the house. And it's a good place to put it. You just put it where somebody can see it. The hardest part of that is actually sitting down and thinking through the process, Googling the information, reading the packet, and putting the advanced directives in place that you want us to follow. Exactly. That's the decision, Sam Month, as you know, having been in this business almost as long as I have, that's the decision you don't want to have in the emergency room. That's the decision you don't want to put your son or daughter or your loved one in a position to try to make those decisions for you. So it's best to have these discussed well in advance. And what this does, it directs us, the healthcare providers, to cease or refrain from certain medical or surgical procedures that you may not want to prolong your life. It doesn't mean, Sam, that we don't treat you. It just means we know exactly what your wishes are as we treat you. Exactly right. That is correct. And when you look at it, it actually becomes a discussion because we all think what we want. We all have a good idea of how we want to be treated and how to spend the last days of our lives. But very few of us, including me in 2017, had communicated that very clearly. Exactly. Exactly. And one of the amazing things is when you look at like kidney disease, that's one of the few diseases that one human can cure another human from. And organ donation is a very, very almost necessary decision needs to be made because every death is a tragedy. If you can save 2 or 3 lives from your kidneys or your heart or your lungs and so forth, it is really a very, very rewarding process to do and to see that evolve. It's very not. It's unbelievably easy if we know that's what your wishes are in advance. It's interesting if you want to watch if you're bored one day and want to watch some YouTube videos. Just watch the YouTube videos of individuals who received a donor heart and come back and let the family listen to the donor heart in their chest, and they're basically have been cured of what was going to be a fatal illness. Like the Florida law is actually very simple. The Florida law says a living will, which you can go online and download the one-page living will document, must be signed by its maker, i.e., you, the person. You must have two witnesses, and one of those witnesses must not be the spouse or a blood relative of the maker. And that's the reason why you want two different people involved, because it should be a conversation. Advance directives is a personal decision, but it's a conversation that has to be made by a group process. And it's amazing in the group process, a lot of issues and discussion come out, and having those discussions by your witnesses helps them make the same decisions for themselves. Cannot. Correct. That is correct. There's no charge for it. You also want to say living will Florida. There's a federal law, but there are state laws, and some of the state laws differ from state to state. It's always better if you're living in Florida to have a Florida living will. If you travel to see us for 6 months out of the year from Michigan, Minnesota, New York, whatever, your living will process is different up there. So you should have a living will for the state where you're residing. If you're going to come see us and stay here for 3 or 5 or 6 months, have one in Florida as well. Correct. That is correct. And it's all in plain, simple language. And as you see, it says living will in very bold print right up top. So anybody who looks at that will understand, any healthcare provider will understand exactly what that is. Absolutely. Exactly, especially if you are a member of a condominium association or homeowners association, a church community group, and look around and realize that everybody sitting on one side or the other of you is as old as me, 65 years old. Nobody's going to live forever, but it's very nice for everybody to know what your wishes are in event something catastrophic happens. It's best uses for those who follow after, those who are asked to speak for you when you can't. It's so important that we know as healthcare providers, as physicians, first responders, what you want.
do have some of those cards available. If you want any further information, by all means, reach us on the Facebook page or email us as well as stroke support at halifax.org.
Yeah, thank you, Samantha, for helping me get this important information out today.
No, I really appreciate you coming to take the time to let us know about this because I think it's very important conversation to have prior to your hospitalization.
Thank you.
Thank you, sir.